Mental health and law enforcement seem to be very different sectors in our community, but their work is actually deeply interconnected.
KPAX's Augusta McDonald has more on how they work together to promote jail diversion efforts and how the 2017 state budget cuts have altered that course.
Missoula's jail is often overcrowded with people who shouldn't even be there, low-risk offenders with mental health and substance use issues. State budget cuts have eroded services for them. At the same time, the Missoula County Sheriff says it should be the other way around.
Services need to be expanded, and these state cuts are hindering our ability to do that. And our jail is overcrowded. We have people that are suffering from substance abuse issues, people that have mental health issues, sometimes in mental health crises, and there's really no other place for them in the jail.
These services work to keep crimes and crises from ever happening in the first place by supporting these people in their homes and communities. They play a big part in the county jail diversion plan that kicked off in 2014. This plan was written by a slew of community partners trying to direct nonviolent, low-risk offenders with mental health or substance use issues into more appropriate in-community treatment.
You know, these cuts drastically affect our community's ability to have caseworkers and treatment courts and mental health facilities and workers that are available to meet the needs that we have that are increasing as we grow as a community.
In a presentation to the Missoula County Commissioners this March, Detention Center Commander Jason Kowalski said a high number of inmates are on medication to treat mental illness, roughly 70%.
And so that's exactly who we're trying to divert from the jail, is these people that don't necessarily need to be here, that have a problem in their life that can be settled through case management or some kind of community service in the mental health realm. So we are expecting that we are going to increase our population with mental health individuals that really should be better served in our community, but without that service, they will end up in jail.
He says the jail is not meant to be a treatment center. The Missoula County Detention Center has 396 beds, but often deals with overcrowding and needs to accommodate even dozens more than that. They've been overcrowded since 2010, which drives up costs for basic needs for inmates like food and clothing. They work with about a $14 million budget that has been cut by 4% in 2017. The Montana Department of Corrections adjusted their budget to meet the demands of the state budget cuts by capping the daily rate they would pay to county detention centers for holding state inmates on a daily basis. The jail took a hit during both the 2015 and 2017 legislative sessions. The 2017 session cut was directed at the Missoula Assessment and Sanction Center unit. It averages 142 inmates per day. The program screens all state inmates to put them in the best placement for their health needs. The rate per head per day was capped at the fiscal year 2016 rate, which is about $80. In 2017, the detention center lost almost $370,000 in revenue, which is compounded by losses in that same area in previous years. The 2015 legislature also put a payment cap in place on the daily rate for other DOC inmates, who make up about 30 to 40 people on any given day. This cap caused a revenue loss of $200,000. All told, this is a revenue loss of almost $570,000 annually. Kowalski says they will provide quality service to inmates no matter what, but that they're constantly looking for ways to cut down on costs. This pair of losses will play out in full down the road as the jail tries to stop the revolving door that's sending familiar faces back over and over.
That's the individual that's going to walk out our door when they're released and be back within a day or two, or even sometimes it's 5 hours and they're already recontacted with law enforcement, and the only answer at that point is to bring them back to jail, and it starts all over again. And so that's the frustrating part of working in a jail, seeing these problems firsthand, and that's where the impacts are really going to happen. And we're making such good progress that it seems like we're going backwards, and we shouldn't be. We should all be trying to move forward.
In Missoula, Augusta McDonald, MTN News.
If you want to know more about how the state budget cuts have come into play in law enforcement or mental health services, check out our website or app.